Well, thanks, Mr. Chairman. And first, I want to congratulate and compliment you on your opening statement. I thought you really hit the point on the head in terms of how long this is often brewing before we know of the problems. I mean, I'm an orthopedic surgeon, worked with many people as president of the Wyoming State Medical Society. I think you're absolutely right in the comments that you made. As being from Wyoming, rural health is a big issue for us, and Senator Crapo started by talking about that. And then telehealth is something we've used from a mental health standpoint long before the pandemic. I think the pandemic has brought mental health as well as other kinds of healthcare to the fore in terms of the ability to try to use telehealth much more productively. I think we're hopefully fast forwarded with the acceptance of, as Senator Cardin was just saying, the acceptance of telehealth. My question about trying to just get enough providers on site in rural America, which is what Senator Crapo talked about. So for Dr. Benton and Dr. Hoover and Ms. Lebarsky, when I was in the state Senate in Wyoming, we were very blessed with additional revenue that we weren't expecting, but we had it. And the commitment we made was to mental health. So we put a lot of financial resources and made a deliberate effort to train, to recruit, and to attract more mental health providers to Wyoming. But in spite of our best efforts, Wyoming and other rural states who are trying to make those similar commitments continue to face huge shortages of all types of mental health providers. So the money was there and we still had the challenge. So can you discuss some solutions related specifically to workforce development that you may believe help improve our ability for us through our mental health facilities so we can attract and maintain staff into rural and sometimes remote areas?
If I may, and I think it's a great question, Senator, I think one of the challenges that occurs within our state of New Hampshire is some of the licensure requirements for professionals. We have a lot of silos with our Board of Mental Health Practice of who is allowed to provide licensure supervision for an individual who comes out from their master's degree program. And that at times creates the barriers to who we're able to hire, because if we have to have a specific credentialed professional to provide supervision to that same category of professional, and we don't have them employed at our center, then that candidate no longer looks at us as a place that they want to be employed at. I've talked to colleagues across our state who've lost employees who've went to other states because not only could they make a higher income, but they needed to get the licensure supervision from a particular person. So I think we need to make licensure requirements, create more flexibility on who can provide that supervision in order to attract the staff that are needed to provide the care.
Okay. Anyone else?
I'm sorry.
Yes, go right ahead. No, please.
Oh, I was going to say, I'd echo your comments. Telehealth also adds another opportunity. It is for training remotely. And so for areas where there's a shortage of providers, we've been able to partner using telehealth to expand skills and to train people. Thinking about Dr. Hoover's comments about task shifting, it's an excellent opportunity for us to provide skills for master's level clinicians, clinicians who need supervision, who may be in another state, for backup consultation across counties, but also by allowing us to continue with licensure across state lines, we can actually also provide support for clinicians in those areas. I also just want to mention a quick win is really educating the people that we already have. So the pediatricians, nurse practitioners, other mental health clinicians, master's level people, TRACE, peer navigators, all of those resources in communities can be utilized to support individuals. We have programs where we're teaching grandmothers to do cognitive behavioral therapy for their anxious grandchildren. And so I think thinking about how we provide care differently could provide us more opportunities for mental health support.
Well, thank you, Dr. Benton. And, to Ms. Lebarsky, to your point of I'm working with Senator Smith. It's a bipartisan on people with marriage counselors who do some mental health work as well. And, they're not able to be reimbursed through Medicare and different federal issues too, where they can provide health care. But so it's the siloing by state, but also the federal government sometimes gets in the way as well. And then I know I'm running out of time. We have a commitment to my family to working with families who have lost someone to suicide, what we can do along those lines. We're continuing to look not just to raise awareness, but for best practices. And I know, Dr. Ben, as you're shaking your head, yes, on this, it's a big issue for all of us. So I don't know if you have any final thoughts on that.
Yeah, thank you, Senator, for that question. So, in addition to the suicides, that, over 160,000 young people have lost parents to COVID. And of course, the threat is always not just grief, but traumatic grief. And we're not ready for it. Fortunately, there are quite a few support services available to families who have lost family members to suicide, and for those who are suicide survivors. So, the American Foundation for Suicide Prevention is a resource for all families that provide a lot of support and information nationally for families who have experienced that loss. But we have to pay particular attention to those populations who have experienced traumatic grief, because traumatic grief is more closely associated with the onset of depression. And in order to be preventive, we need to develop early interventions and support for youngsters who have lost their parents during COVID, and for individuals who have lost their families to events like suicide and homicide. So thank you for that.
Thank you, Mr. Chair. Thank you, Deborah. Thank you, Mr. Chairman.
Thank you, Senator Barrasso, and we are very much going to focus on the best practices that you mentioned. It's a very solid way forward.